Welcome to the second edition of Working Lunch, the SLO Chamber's weekly series where we sit down with key community leaders and hopefully get to enter the last few hours of our work week feeling a little more connected to our community in these isolating times. I'm Jim Dantona, President and CEO of the SLO Chamber, and today you'll get a peek behind the curtain into the woman of the hour, week, month, year, Dr. Penny Borenstein, the Public Health Director for SLO County. I assure you that if we had confetti cannons and a marching band, they would be deployed to welcome her. And I want to set the stage for our conversation today. We're not specifically going to talk about the current crisis, nor what's being released later today. And based on that being released later today, thank you so much for being here, Dr. Borenstein. I know this is a bit of a fast-paced day for you, and it wasn't necessarily set up to be on this day, having these things come together. But I wanted to get to know the woman as the person who is leading our county through these difficult times. So thank you so much for being here, Penny.
Sure, thank you so much.
Well, want to get started, and it's as I was thinking about having this discussion, I wanted to start off at the beginning. Obviously, you got an MD, a Doctor of Medicine degree, but did you know in medical school that you wanted to be a public health director?
Yeah, so I was a completely odd duck in medical school. I was the rare student who went to school knowing what a Master's of Public Health was and that I wanted one when I was completed with my medical studies. In fact, I was the first and perhaps to this day only medical student who did an elective rotation at the county health department. That's how geeky I was. And yeah, I had gotten my appetite whet by working at Johns Hopkins as a lab technician and wound up being friends with someone who went from the lab to get a public health degree. And I wound up hanging out with her and all of her friends. I was like, yep, this is what I want to do in my career. Well,
and it's, again, trying to figure out how, what was it that was that initial kind of draw? What was it that, was it thinking in the bigger picture as opposed to individual patients, thinking about the whole society? Is that what kind of drew you to that?
Yeah, so I've always had interest in social justice. I was going to be a teacher through most of my school years because I wanted to do it better than many of my teachers. I liked science. I liked math. I was not pre-med in undergraduate school, but all of those things kind of came together for me of wanting to do something important for my community and apply the areas in which I felt I was pretty good at. And for me, that was addressing the community's health.
That's awesome. And it's, again, I'll say I've spent 20 years in local government and certainly have seen all of the recommendations and guidelines coming out of the public health director, no matter which county I was in. But, it's really interesting to me at this point to see certain segments of our community elevated to that hero status for the first time. People who work in the healthcare system, epidemiologists, and especially our grocery store workers and agricultural laborers. And I'm thinking maybe we'll see the first Dr. Fauci and Dr. Penny Borenstein this Halloween. And I was just shown a line of toys that Mattel is launching dedicated to those frontline workers. How does this newfound recognition feel?
So I have to say it's been absolutely surreal. Public health has always done its work in the shadows, and when we're doing a really good job, no one knows that we exist, right? So everything runs smoothly at restaurants. We do home visits for high-risk parents. We give immunizations. We give health education messages. And if all of that takes hold, there are no problems in a perfect world, and we operate behind the scenes. And I've always enjoyed that, except for budget time. So it's been absolutely incredible, and in fact mind-blowing, the amount of kudos and that I personally have gotten awareness from the community about what public health is and what we do, at least in this one regard with respect to communicable disease control. I hope that we, will not need to do this again anytime soon or ever in a lifetime. But hopefully it is creating a level of awareness about the importance of public health.
Yeah, it is great to, folks who may not have dug into the depths of where government does all of the levels of it are probably seeing a lot of things. I don't know how many people necessarily knew what CDC was or the World Health Organization or any of these pieces. And it's terrible that we're getting to learn them in this way. But I am thankful that people are getting to see these things. And you talked a little bit about the kudos that you get personally. How has the transition to being SLO famous been for you?
I must say it's been super humbling and nerve-wracking to a degree. I wake up every day wondering what I'm going to do right today, but I also wonder what I'm going to do wrong today and how many people I'm going to piss off, because it is very weighty to have the community's well-being in my hands. Not just me alone. I've got a really amazing team that I'm working with, really smart people at every level. So at the local level, state level, we're less engaged in the federal level. But there's a lot of people that are just doing really smart work and working incredible hours and smartly and in a committed way. I'm the one who, I think half the time my name keeps getting mentioned as a way for everyone to hide behind that cloak. But it also, it is a recognition that this is a public health event and we need public health leadership. And so I and a whole army of public health leaders across the country and the state and here on my team are just really trying to do the best we can. And as I said at the outset of this comment, it's very humbling because I don't take any of the decisions we're making lightly. We know lives are at stake no matter what, whether it's the disease or the impacts of the mitigation measures that are having significant and real and lasting consequences on people. So it's something I think about all the time.
Yeah, and it's, I would mention here real quick that if you're watching on Facebook Live and you do have a question for the doctor, just go ahead and throw that in the live and we'll kind of get to those a little later. But, you talked about, again, a terrific team behind you and not taking lightly the decisions that you're making. And thank you for all of, on behalf of all of us who don't get to be in my spot to say it directly to you. But I know I've heard so many wonderful things about the work you're doing. If you could wave a wand and everyone would magically do one thing, what would you choose to have all of us do?
So I think what really jumps to mind is to ask people to not be judgmental at this time of great crisis and great stress. It is really easy for one person or one family or one business to look at the next and say, you don't understand what's going on for me, and this is the way it needs to go for my own sanity and salvation. Even using as an example mask wearing, I've gotten so much input on that. Why don't you make it mandatory? There are downsides, and there are people who probably shouldn't wear a mask, and there are children. There's lots of things that go into every one of these important decisions. And so what I would ask of everyone in our community, this is not a political comment, but is to be on everybody's side, because we are all in this together. I know that has become a bit of a pithy statement that you see on TV, you see in emails, but it is absolutely true. As this epidemic and event goes in our community, so goes all of our well-being together. And so I just really would ask that people not be quick to judge other people's circumstances, and to really try to understand that everyone is doing the best we can to try to move forward in a smart and steady and helpful way.
I will say that that is so moving, and you know, like you said, you know, the words sometimes get spread around and used in lots of things, so it starts maybe to lose some of its meaning. But I was reading some on social media which said, you know, there are going to be people who want to go out when the order's lifted, you know, be kind. There are going to be people who wanted to stay inside when the order's lifted, be kind. You know, I think what you just said there is so powerful about, there's a lot of people with anxiety and fear of what's happening today. To not be judgmental about it is fabulous. And I want to thank you for saying that. That is a very powerful comment here. And as, again, you know, it's not like you work through pandemics monthly and, you know, oh, okay, I'm going to figure this out, and we're going to pull plugs A, B, and C, and we'll do it this, and this is exactly how it works. The last one to hit probably at this scale that as a population we see is probably 102 years ago. Certainly we all heard about SARS or MERS or Ebola, but it never really got to the point of impacting our entire population. So is there a certain public health icon that you were looking to or trying to channel right now? I mean, certainly, as we've said, we're not all familiar with the public health icon, so we'd love to hear kind of who's kind of motivating you, or at least helping you figure this out.
Sure. Well, first of all, I want to tell folks that even though I, in my lifetime, all of us in our lifetimes have never experienced anything like this, we have in public health planned for this exact scenario for at least a decade, if not, you know, quite a bit longer. Again, planning is a totally different situation than actually living it. But we, you know, have had at the ready, what do you do in circumstances when you have to pull out the biggest public health measures like isolation, quarantine, stay-at-home orders, shelter at home. Again, the word humbling comes to mind all the time. And so when you ask me, you know, who do I look to as the best voices or heroes in this, certainly Tony Fauci has been one of those voices, Dr. Deborah Birx as well, but Anthony Fauci's been at this for a very long time, and he's at a point in his career where he can say what he thinks, and I very much appreciate that. The other person that really comes to mind is Vince Cavella, who is known for risk communication strategies, and I was going to say much more important, but as important as in tackling the disease is the communication that goes on between the public health leadership and the community, and vice versa. It has to go both ways. And so for those of you who are not familiar with Vince Cavella's work, he has some books out there, but one of them I had read, I'm not remembering the name of, but was sort of the 23 points of how best to communicate risk in any situation. I happen to know that Mayor Rudy Giuliani used him as a model when 9/11 happened. It is probably the most difficult thing to do in this sector of public health, communicating effectively about what the risks are, how bad they are, what they're not, how to get your mind around relative risk. So I would say that he's definitely one of my heroes in this arena.
Well, and it's as you are doing, communicating directly 3 days a week and trying to communicate very difficult subjects and balancing all of that, I can imagine that would be an extremely important part of what you have to do and what all of us should learn. So I'd probably encourage anyone, you know, if the communication that's happening around 9/11 and a pandemic are helpful, that's fabulous. I have not read it. I'm definitely going to have to check that out. It seems really interesting. Do you see any health-related silver linings in what's happening right now? I mean, obviously there's terrible things happening, but are there good things that we're going to pull out of this, you think?
So on a really pedestrian level, I made the joke early on, except for my budget. So yeah, we're all going to have, and I don't mean to be flip at this moment in time, but not so much for me personally, professionally, but public health. I went into the field of public health because I really believe that every dollar spent in that arena is really well spent. And we put a very extraordinary amount of our GDP into healthcare, whereas public health only gets 3 cents on the dollar typically. So perhaps this begins to shift the balance or pivot us a little bit more toward an upstream approach. Prevention, vaccination, screenings, testing, healthy living, all of those things that I have spent a career advocating and working toward, that ultimately will land us as a society in places that I won't have to talk as much about the vulnerable population with all their comorbidities and disease that makes them more at risk for something like COVID-19. But probably of equal importance, or something that I've been thinking a lot about in this, is how everyone now is an infection control expert. And that's great. And that is really fabulous that all of the teaching over my career that I've tried to do in, wash your hands and cough into your sleeve and, be careful about everything that you're touching and how not to spread disease, etc. Hopefully this experience will leave everyone with some better understanding of how to prevent disease spread in general, so that when next flu season comes around, maybe we won't see quite as much influenza. When the norovirus outbreaks happen, maybe we can get it under control better. So I think in that way, we're going to see some good outcomes from this.
Yeah, that's an incredible. I definitely would, as folks watch this and are participating right now, think about what Dr. Borenstein said in advocating for those dollars for public health. Again, trying to get in front of it. Again, it's a dollar spent upstream is going to be worth 5 times as much probably downstream in terms of having to save resources and the long-term impact of whatever happens. But also, I love your point there on washing your hands, and this may actually reduce influenza of other types after we get through this, because people have learned all of the things that we probably should have known for a very long time that folks in the health departments are telling us. This just really drove it home in a terrible way, but hopefully something that people take to heart. I think an interesting thing to know is, have you gotten a chance to speak with Dr. Fauci?
No, but a good friend of mine has a lineup of the cast for the movie. Who's going to play me and who's going to play Dr. Fauci. I hope I'm not being too comical, because I want to, we do need to find some measure of levity in what has been a really serious set of circumstances, and for a very long time. But I do find that if without maintaining humor, we're really lost. So I hope that I'm not offending anyone by making jokes.
Well, and I would say to that point, it's and that was hopefully the idea of this whole thing, was we get to see you on KSBY or the live stream at 3:15, but we don't get to know who you are. And so knowing that you're someone who, this is how you work through these issues is comforting to me, I know. And I hope the folks listening, because it really talks about the person you are, taking things seriously. We can tell that from the piece, but knowing some of your background. So I hope no one else would take it that way too. Speaking of which, has there been something that made you smile or laugh in the last weeks?
Oh my gosh, the number of memes are unbelievable. But, yeah, so I watched The Masked Singer with my daughter. That's what lets us unwind together.
Oh, that's hilarious. I just found it. I had been making fun of it for a long time. Like, I'm not watching this. This seems silly. And I started watching it, and I'm now hooked. My wife and I are hooked. It is a fun show. We're getting a question from Facebook Live at what is the strongest part of the health department in SLO County, and what areas require kind of more input or information or improvement?
Well, so a couple of things that are absolutely related to this event that come to mind immediately is we have this gem of a public health laboratory that I think was virtually unknown to folks before this event, maybe still unknown, but we have only a half a dozen people toiling away literally many a day, you know, working well into the evening to make sure that the specimens that we're testing get done in a timely fashion. This particular laboratory is a BSL3, that means Biosafety Lab 3. That means that we handle all manner of what we call select agents. So anthrax, ricin, smallpox, God forbid. And there are only 2 BSL4s in the world. So we've got a pretty robust and really state-of-the-art laboratory within the public health department. Another area that comes to mind is our environmental health services. And I know probably I've got a lot of business folks on the call and they think, the health department's here. But I'd like to think, and I know that the leader of that unit, Liz Posabon, she takes a very helpful and technical support approach to the services that we provide in inspections and permitting. And why I'm thinking about them is they have played a really big hand in the guidance that's coming out later today to help businesses figure out how they're going to come back and provide services in an environment with a new perspective on the need to social distance, to maybe limit customers. So they have put an awful lot of energy and thoughtfulness into not just saying thou shalt, but really providing best practice kinds of guidelines. And that's another area that has been really strong within our department.
That's fabulous. So interesting to hear about the different levels. And are there more that you think we need to kind of plug into and help grow?
Yeah. Well, so, you know, I talk about my 6 divisions as my children, and I've mentioned 2 divisions out of the 6, so I hate to say, you know, who's not included, but, you know, an area that we tend to struggle with that's underfunded, misunderstood. We've got great people working in it, but is our health promotion unit. So that's where we do a lot of things to try to help the community's health in general move to a better place. So that's our tobacco control program, our obesity prevention efforts, our oral health, injury prevention. I think that sometimes, even for some of my own bosses, I don't know if any of them are listening, but sometimes those areas are seen a little bit more as fluff, and I think they are quintessentially important to us being the healthiest community that we can be.
So it's interesting. And again, I think, as you said in previous comments, I think all of your divisions are going to start to see a lot more interest and hopefully support from government, from public, to make sure we're doing that when we get to those budget times. And hopefully your budget times will get a little easier now, unfortunately, due to this situation. Some folks wondering if, and pardon me if this is is too personal, but do you have a family? Do you do you have children? And if so, you know, how does it affect you or not affect you in dealing with that?
Yeah, good question. So I have 2 children. They're both teenagers, but my son, who is he's almost turning 17, has significant special needs. So for all of you parents out there who are dealing with online education, multiply that tenfold with a child who can't really do virtual education as well. And it has been really an incredible struggle. My 14-year-old daughter has come through this like a champion. And she's been extraordinarily helpful. I also have had the good fortune to actually fly my sister out from the hotspot of New York where I grew up, if you couldn't tell from my accent or my demeanor. She has been an absolute lifesaver as I'm putting in 12, 15, sometimes longer hours in our emergency operations center. And still finding the important time to really talk to my daughter, especially about the fact that we will get past this, that this is an absolute historic moment, that she will look back on it with some measure of fortitude built in. And, you know, it really, and again, I'm going to use that word humbling. My daughter has not once watched any of my media briefings. And so when I come home and sort of tell her what was up today, and I'm like, hey, did you catch it? My sister's watching it. And she's like, no, Mom. I'm like, okay. So
there's nothing like family to bring you back down to earth, right? And I think that along those same questions that came out of the feed was the idea. Do you have some words, and I found this one comment really interesting, of comfort or encouragement for people who are starting their families right now or giving birth to children right now, in terms of what to expect, or, you know, again, that we will get through this, but any other ideas for them to just how to keep plugging through?
Yeah, I know that there's incredible economic hardship out there. We hope to be moving as quickly as we can on that. I think the world has, and our community especially, has shown its best colors. If I were bringing a child into this community right now, I would feel not just the love of my new baby, but the love of the wraparound of the community that has really come together. You know, businesses that helped us build the alternate care site, lots of volunteers that we've recruited. 600 people answered the call of, you know, are you a medical or other type of volunteer available to give in this situation? The food bank has really stood up. So I mean, there's so many examples. I know I'm just naming a few. Again, the grocers, the pharmacists, the farm workers. It has given me such joy and pride in our community to see how many people are just stepping up and to bring a child into that environment of there's so much goodness out there. It's a wonderful thing to see.
Wow. You know what? Actually, we're getting to our time. Unfortunately, I could do this for 2 hours with you. I know you guys have got something big coming up in a few hours, so we have to let you go. But I'm so thankful, and those really, really appreciate the candor that you have for our community at all levels. Where, you know, I get to listen to you speak at the board before this all happened. I get to listen to you on your press briefings, and it really, truly, the words of it, there's a lot of support on this Facebook Live. I can just see it flying by, telling them thank you. So on behalf of all the folks who are here watching, they say thank you, and I say thank you. We're so appreciative you taking the time to chat this afternoon. And if you want to spend more time with Penny and you've enjoyed this, tune into the county's public health briefing at 3:15, where Penny and her team will be sharing the START guidelines, which are the reopening guidelines, I think, for reopening, the reopening guidelines today. And we hope to see you next week, same time for a working lunch, same place, when we talk to Kevin Harris, the managing artistic director for the SLO Rep, about how the arts community is adapting and what's inspiring him these days. If you haven't had a chance to check out their Instagram and intermission show, give it a shot. It's fabulous. We'll have him here next week. Let us know who you'd like to have a working lunch with by emailing us at slochamber@slochamber.org. And we wish everybody to have a wonderful weekend. And again, thank you, Penny, for being here. And thank you for all the incredible work you're doing.
And thank you so much, Jim. It's really been a pleasure to have a conversation.
Thank you.